Good morning, good evening, good afternoon. My name is Lorenzo Alonso. I'm from the Foro Association to Improve Diagnosis. And today I want to show you a subject that I just call situational awareness, the missing link in medicine. This is a term that is coming from the flying combat, from the pilots, that when they came back from the battle, some people asked them how they were able to survive. And all of them almost universally say that they were very aware about the situation. They could have a mental model about the situation and they take decisions soon and quick. Then I think that this concept could be interesting to teach medicine in general and also nursing. We are going to consider young doctors when they start, they have a simple idea about the diagnostic process. They just think that they have the information, they see the patient, they apply the knowledge, and they get the diagnosis. But what is clear that this is not true. Reality is different. They have to handle a lot of data. They, of course, they need to have a lot of knowledge about the diseases. Also, they have to be aware about the context if they work in the primary care setting or they work in the emergency department. And after that, concepts like biases, risk, safety, complications, and harm. All these are steps that can appear in the process of the diagnosis. The truth is that after a period in practice, the reality can be like that. A lot of data, a lot of situations, a lot of context, and they have to organize all of them. At the end, they are able to do, but they take time for them to do that. We're going to speak about situational awareness only during the diagnostic process. We are going to go further with decisions or goals. It is a curious thing, at least for me, because young doctors in general they are very used to play with electronic games, and in these games, all of them are full of risky situations, dangers. They have to protect themselves. That means that in their brains they have this concept about risk, safety, protection, process, but when they arrive to the clinic, in my opinion, this is something that is harder to teach to them in general. Uh, Talking of defining situational awareness, the definition came from Mika Ensley. This is a classical book, a classical paper, and it's clear it's divided in three aspects. In summary, situational awareness, the definition is the perception of the elements of the environment between a volume of time and space, the understanding of their meaning, and the projection of their state in the immediate future. Of course, doctors they work in different contexts, but in general, all these contexts, all this situation can be included in this schedule. You see, there are three steps. One is perception, the second one is comprehension, and the third one is projection. We like to show here a practical example. This is a patient who came to the hospital 5 days after receiving chemotherapy. She started with a fever, and the doctor there in charge decided to take some sample from the blood and from the urine, and they started with antibiotics. They also take a blood sample. They see that the patient was neutropenic. But 2 days later, they realized that the patient also have a special device used to receive chemotherapy, a port there, and then they took some sample from the blood inside the port, and there was an infection. If we attend to the model of situational awareness, The perception here was biased because they don't pay attention to the whole aspect of the person. You have to know that a patient under chemotherapy could be the receptor of different devices. And also, you have to have the whole idea, the comprehension of the situation, even more if you don't find a clear explanation for fever, for instance, apart of neutropenia. And also, it's important to have an idea, to have some projection, because once you realize the whole problem, you can tell to the patient, to the family, what is going to be the most probably evolution. Here we have in a more clear schedule the three levels of the situational awareness model. The first is perception, uh, mainly information in medicine. This information can be without bias. Sometimes we know that we have a lot of bias, cognitive bias, and also there is a problem with information because there is not a systemic link between different aspects of the data of the patient. The second level is comprehension, that we can make a summary. You can have a mental model, and usually it's better to have to collect all the signs and symptoms of the patient under the syndrome or one or two syndrome. And the third level is projection. It's something that is not at the beginning very intuitive, but it's something that we are doing always. We see a patient and we try to project in a way where it's going to be the probable evolution. And this is important, can be practice day by day, but it's something that is not difficult to get, at least initially. At the end, we can say that this model of situational awareness can be very useful to teach medicine and nursing to young doctors and young nurses. And also, it's a model where we can fix the whole theory of the problem with the diagnostic process. This is something that seems to be very, very difficult, but the truth is that we have in our brain all this schedule about perception, comprehension, and projection, because in a way, it's the same way of working, the same behavior that came from the old people when we were hunters. They had to be aware about the risk, about to choose the best place to hunt, and they had to be very, very aware about the all the dangers. I hope that this could be useful, and thank you very much for your attention. I will meet in another video from four of us. Thank you so much.